you froze there for a second. That was weird. It was like you were talking and then there was nothing. Okay, so before we start, maybe it just now started. I have no idea.
We'll smile.
Good morning again, just in case.
We're really not good at this. We're not getting any better.
Well, it said it was going live, and then it like did a thing, and then hi Jaeger. So I was thinking in the car on the way here today. Yeah. I know you're excited about this. That we needed a theme song. Her face right now.
And what exactly does this mean for me?
What theme song, if you had to pick a theme song, what would you pick for this awesome, technically produced live video situation?
Carry On.
That's not what I picked. That's not what I picked. You want to hear what I picked?
Yes, I would love to.
Are you excited?
I'm so excited.
Hold on, we turn the volume up. Ready? So we can start with some dancing?
I think I'll just sit here. Oh, Jaeger can dance.
He can. Because that's our thing.
Okay.
When we do stuff, we're like, y'all ready for this?
That's true.
That's true.
I mean, it could also be shot.
Maybe next week.
Okay.
We'll do a different theme song every week.
Oh, okay. Do I have to dance every week?
Yes.
Oh, God. No one wants to see that.
Crystal's super sweet moves.
It's a good thing you guys aren't paying to watch it.
Sorry.
Because you would want a refund.
Free. It's free. So, yeah. 100% money back guarantee on this video. If you're not satisfied, we will give you all your money back for what you paid for this video. People are going to be like, I need my time back. That's what I mean.
Money is time. Or time is money.
Yeah, time is money. There was nothing I could come up with that was like a theme for what we were talking about today. Yeah. I just was like, what song fits with us? And that's something we would.
That is good.
We'll bring in some other ones, because there's some other songs, too, that I think, like, shots.
But not in the way that they think.
Well, no. Not in that way.
Yeah.
Just in, like, the vaccines way. But
yeah.
So this week we're talking about allergies. Because we're seeing a ton of allergies already. Yeah, it's just that time of year. Everything's blooming. There's pollen everywhere. Our windows are covered in pollen right now. My car is always covered in pollen. So we're seeing a lot of patients with allergies right now. So what are the most common symptoms that we see of allergies, Crystal?
Scratching, licking, ear infections are a huge one.
Yeah.
Red skin. I think that covers it.
Yeah, sometimes you see coughing and sneezing.
Yeah, runny nose.
Because even though, in people, that's usually how allergies show up is more of like respiratory disease. In dogs and cats, we typically see it as a derm issue, so skin, ears. And I think that's something, too, that not everybody is aware of, is that ear infections, especially chronic ear infections, can be due to allergies. So that's something to keep in mind as well, even if that's the only symptom that your pet is having. Especially if we're getting multiple ear infections, you usually will start talking about working up allergy issues.
Or like back-to-back, or just during a certain part of the year.
Yeah.
Yeah.
Yeah. So like I said, it's the time of year for the outdoor environmental allergies, but they can be allergic to other things too. So there's non-seasonal allergies, like things that are inside the house. We had a patient recently who was tested. He has allergy tested and was very highly allergic to like any kind of dust mites. I think normal is like the number like less than 100 or something along those lines. This poor guy, he was like at 1,800 for some of the dust mites, and like I told his family, I was like, it's it's not a judgment on you. It does not matter how clean your house is. You could be cleaning it top to bottom every single day. There are dust mites present, and so if they're there, he's gonna have allergy flare-ups. So that's some of the indoor things that they can be allergic to. They can be allergic to wool. They can be allergic to cats. Dogs can be allergic to cats, and cats can be allergic to dogs. They can be allergic to us, which is crazy, yeah.
Crazy.
But human epithelium, so our skin cells, that's on the list of things that they test for as well. Of course, fleas is a common one too. And then things that are not environmental, like food. Food allergies are things that we see quite a bit too. And that's usually, so when we're working up and treating allergies, step number 1 is typically get the itch under control. He says, yeah, I don't want to be itchy. Get the itch under control, because then that buys us some time to figure out what's going on, do some further testing, and sometimes that's all they need, is just get the itch under control. Within a couple weeks, they're back to normal and they're good. And if we only have to do that a couple times a year, that's not so bad.
Yeah.
When it's, he's growling. When it's an ongoing issue, we're lasting several months, or it's getting worse year after year, that's going to be a time when we're going to want to start looking into some allergy testing. So allergy testing can be done a couple different ways. It is either done with a blood test, and that's how we do them here, or some of the dermatologists will do the little prick tests, like what they do on people, where they'll poke you with the different allergens and watch it bubble up and see, they rank it 1 to 4 or something. Compare it to just a little bit of saline that was tested, so they should have no reaction to that, or straight histamine, because that's what is actually responsible for allergic reactions. So that should be the worst one. So then they kind of grade it based on those 2 things. And then from there, they're able to create immunotherapy. What is immunotherapy?
So immunotherapy is basically where they take all of the things that they're allergic to, and they put it into an injectable form of therapy. So basically, you're injecting what they're allergic to.
Yes.
To build it up into their system, so that their reaction to it is very mild.
Yeah, so basically it starts at a very, very low dose. The goal is to try to teach the body to ignore these allergens by constantly challenging them, exposing them to it. That can eventually teach the body to ignore those things, hey, this isn't a threat, stop reacting. So that takes a long time for immunotherapy to work, usually 6 months to a year to really see full effect.
So it can be frustrating.
It's slow going, but so oftentimes we have to do some other things while we're on the immunotherapy. It's also pricey. The allergy testing and the immunotherapy are not cheap. But I think especially if you have a dog that's, middle-aged or younger, I think it's a good way to go, because really if you factor in how much you're going to spend on medications and other treatments over the course of that animal's lifetime, it's better in the long run, for sure. You just have to be prepared for that up front.
Yeah, and then it's going to take a while.
Yeah, you just have to be mentally prepared for that too. Yeah, because it's a slow process, but it does work. So other things that we'll do before we get to that point, one of the first things that I like to do is a food trial. So rule out food allergies, or at least see how big of a component food is. Because truthfully, most of these animals aren't allergic to just one thing. They're allergic to multiple things. And so what happens is all those things kind of add up. So if they're allergic to chicken, and then they're also allergic to mold, and they're allergic to dust mites, and they're allergic to, I don't know, what's another one? Fleas, different trees, and things like that. If we can, depending on which thing has a larger component in it, sometimes just taking out the food portion of things is enough to get them comfortable at least more frequently. Maybe we get them down to where they're only having allergy symptoms once a year if we do something with diet. So,
or just in the spring. Or
yeah,
in the
exactly.
Summer when certain things start blooming and coming out.
Yeah, and so it's all additive. So if you take 20, like they could be allergic to 10 things before they start showing symptoms, but then you have 11 things in there. Well, if we could take out the food, great. Now we've helped significantly with that animal symptoms.
Well, and that's something that they're getting consistently, usually twice a day.
Yep.
And so if we take out the big portion of that.
Yes. And what are our most common food allergens, Crystal?
Chicken.
What else?
Beef.
Uh-huh. Anything else? I usually say chicken, beef, and lamb.
Lamb. Okay.
Yeah.
You're talking protein. Because can't they be allergic to like the other fillers? Because they've got like the chicken and rice
potatoes,
thing.
sweet potatoes, rice. Yeah, they can be allergic to anything in the food, but more times than not, it's to the protein that's in there, which is why, too, we'll have people come in and be like, oh, I've already changed his food so many times, or he's on a good quality food. I'm like, well, that's great. That's awesome. I'm glad to hear that. But if you've changed his food multiple times, but it's always chicken, if he's allergic to chicken, it doesn't matter. It doesn't matter the quality. Right. So,
and another thing with that, for a true food challenge, they need to be on the same food for 6 to 8 weeks minimum before you're going to notice a difference.
Yeah.
So,
and majority of the time, too, we'll have people come in and say, oh, well, they're on a grain-free diet. Cool. Neat. But grains aren't a very common food allergy. Same thing with gluten. There's who is it? It's Irish setters have a true gluten allergy. Not all of them, but some of them can. But that's really the only breed that I think it's been identified in that they have a gluten allergy, or they could have a gluten allergy. So, you see all these foods on the shelves, and that's hard because it's a lot of marketing. And so they're, oh, it's grain-free, or it's gluten-free, or, it's human grade. I don't know. So many things. But when we're talking about allergies, our goal is to eliminate whatever they might be allergic to. We're not, yes, we're worried about quality, but there's also, it's the ingredients that are in there. And you have to be really careful, too, because when you're buying the foods, and it might say that it's salmon and rice. But if you actually look through the ingredient list, sometimes third or fourth down the list is something with chicken in it. So even though the front of the bag says salmon, doesn't mean that there's not something else in there. So to do a food trial, Jaeger's just up and down all over the place. So to do a true food trial, what we recommend doing is the hydrolyzed diets. Do you know what a hydrolyzed diet is? Do you know what they actually do?
Where don't they like pressurize it, or they do something to make, like, it's a regular protein, but they break it down enough to where the body doesn't recognize it as whatever it is.
As an allergen.
Yeah.
Exactly. That's exactly what it is. So things like those are the prescription diets. So usually we'll do that as kind of a test before we get into true allergy testing. Before you spend several $100s on allergy testing, let's try a food trial. Let's do a hydrolyzed diet.
We're friends right now. Just don't touch his ears.
I know. So if you do the hydrolyzed diet for 6 to 8 weeks, like Crystal said, and be really, really strict with it, it means nothing else by mouth. No treats, no chew bones, no table scraps, no extras, no sprinkling cheese or something.
Yeah, otherwise you're
mixing in chicken broth. Yeah,
you're wasting your money on your food.
You are, yeah. So it's I don't know what I just did. He's my friend now. Okay. Oh, kisses. Okay. Squeaking and kisses. Thank you. You're interrupting what we're saying. That's fine. That's fine. So we do the hydrolyzed diet, and if it makes a significant difference, God, if it makes a significant difference in their allergy symptoms, great. Then we don't necessarily have to stay on that diet long term. You can, but I also understand that they're pricey. You're looking at like $100 a bag for the big bag. So maybe keeping them on that long term is not feasible, but we can start playing with things and figuring out what it is that they are allergic to. So we start doing what's called novel proteins. So that's going to be like your weirder sort of protein sources, like kangaroo or venison or sometimes duck, and trying those things. And the goal is to pick something that they have not had in the past. And that's why, too, I think there's a lot of people that will rotate through different diet flavors and that can make it a little trickier when we're dealing with food allergies, because if you've already exposed your pet to all of those things, he's fine. If you've already exposed your pet to all of those things, it makes it a lot harder to come up with something that is novel or something that their bodies haven't seen before. So what else do we do? Let's see. So allergy medications that we might start your pets on. There's the old standby of steroids. Steroids are cheap and they work. But what side effects could we see?
Drinking a lot.
Yeah.
Going to the bathroom a lot.
Yeah.
Hungrier, or they can be.
Yeah.
Can make them a little cranky sometimes.
Sometimes, yeah. Sometimes it can make them cranky, or it can make them kind of dopey. It's definitely personality changes.
Yeah.
Yeah, for sure. And long-term use, we worry about like their liver and their kidneys and hearts. It's definitely not a good thing to be on long-term, if at all possible. And these days, when I first started practicing, in the Middle Ages, no, 10 years, even just 10 years ago. That's what we had. It was antihistamines, so like your Claritin or your Zyrtec or your Benadryl or steroids. And we didn't have a whole lot else. And, the antihistamines, if you have more severe allergy, they're not going to cut it. They're fine to use in addition to something else, but unless the signs are real mild, it's not going to do enough. You got to do something stronger. So we were stuck with steroids. But then, thankfully, shortly after that, there were some newer medications that are now on the market. So we've got Apoquel, which is a pill that they can take.
It's wonderful. Life-changing.
We both have dogs that are on that.
It's amazing.
It is.
Pricey.
It's pricey.
But it works.
But it works.
Amazing.
And I don't have to get up in the middle of the night to let my dog go out to pee because she's drinking like crazy. So, makes a big difference. Another one that's on the market is called Cytopoint. That one's really nice because it's an injectable. So we just do that here. Typically it's once a month, but sometimes over time when they have received multiple injections over the course of several months, sometimes we can start spacing them out further and further. Cost-wise, I think it's generally pretty similar. It just depends on the size of the patient. Jaeger size would probably be cheaper than Apoquel, honestly. And just like any allergy medication, sometimes one works for a pet better than another, and you don't know until you try it. I usually start with the pills simply because in my own home experience it worked better. I think that's part of it. But also, we can always stop them if we need to. We can do just a small amount. We can do just a week or 2 weeks. And then if that's not working, stop it, switch to the injection. Whereas the injection, you had to pay for basically a full month worth. And then if it doesn't work, it's like, that stinks,
Right.
So, we'll also...
It's just to get them through, like, a week. Maybe they've got, like, a really bad ear infection.
Yeah.
And they're super itchy.
Yeah.
We can get them through.
We see ones that come in with flea allergies. We're treating the fleas, and that's cool, but we need to get them comfortable as well while those fleas are dying off. So that would be a perfect time for something like Apoquel, where we could just do like a week and call it good. And that's all that they need. Now the fleas are dead. They're not exposed anymore. Everything's calmed down. We don't have to worry about it anymore. So there's all different things. There's also a medication called Atopica that has been around for a little while. It's Cyclosporine, so it's an immunosuppressive, so meaning it suppresses the immune system. So that's what's happening during an allergy is the immune system is overreacting to something that it should not react to. So by putting them on an immunosuppressive, that calms that down. Now, of course, that has other things that it can cause too. You know, they'd be more prone to different infections and things like that. So, you know, there's definitely risks with that too. It's also not cheap.
Yeah.
It's definitely not cheap. And so, you know, wasn't a really great option for the allergy patients, you know, even 10 years ago when it was available. Hi, what? Why are you obsessed with me today? Why are we friends today?
He's like, well, we're always friends.
I know, we're always friends, unless I have a needle.
Yeah.
Unless I'm going to poke you with a needle, and then he screams.
It's embarrassing.
He just has to see the needle, and he screams. He's kind of a drama llama.
Yeah, or you just like pick up his skin like you're going to give him a
that's
shot.
all it takes. Or I could just lightly brush his ears with my hands, and that would be, There's
Very-
nothing wrong with his ears. He just is very sensitive.
Yeah.
What are you doing, man?
If you touch his ears.
So other things that we'll do when we're treating allergies, a lot of these guys have bacterial infections or yeast infections on top of the allergy because the skin has been abnormal for a period of time. And so they'll often need antibiotics or medicated shampoos or mousses or something along those lines to go along with their allergy medication. Thank you. It'll happen a lot of times that you'll end up with an antibiotic and something for allergies to go home with. Bathing is always a good thing. It always helps to just kind of, even just like a non-medicated shampoo, just to wash off some of the allergy stuff that's floating around in the air, the pollens and that, or wiping feet when they come in from outside. If you have one that's licking their feet or chewing at their feet a lot, just wiping them down with like a damp towel could help significantly every time they come in from outside. So what else did we do? Can you think of anything else? Or other questions that people usually have about allergies?
I mean, a lot of times people want to know if the medication we're sending home is something that they're going to be on long term. Mm-hmm. And that's really just dependent on your pet.
Yeah.
So, you know, if like I said, we're just getting them through their ear infection, you know, it may not be something that they're on long term. You know, I have one at home, and I know you do too.
Yes.
That has been on Apoquil for 3 years now.
Yes.
I mean, year round, every time I try to take him off of it, mm-hmm. his skin turns bright red, he starts licking everywhere, he's chewing himself, and then, unfortunately, he has to go on antibiotics again. Mm-hmm. So for us, it's not even worth trying to take him off of the Apoquil mm-hmm. anymore.
Yeah.
But some pets just need it, you know, during the spring or during the summer or maybe in the fall, mm-hmm. and then they're good the rest of the year. So mm-hmm. it really just depends on your animal and what they can tolerate. So some pets do really well on just an antihistamine, like mm-hmm. we talked about in the beginning. You know, mine, that wasn't enough for him, so he is on the Apoquil. And with that, too, it's the lowest dose that we can make them comfortable.
Right.
So let's say their dose is a full tablet. If they do well on a half, absolutely. Like, go ahead and do that. You mm-hmm. know, that's what I do with mine most of the time. He gets a half of a tablet. Right now, we're trying to do a half of a tablet and adding in some Benadryl, and that seems to be doing okay right now, mm-hmm. but there are certain times when that's not enough even. So he has to get a full tablet.
Yep. Right now, Lana's like chewing the bejesus out of one of her front feet. So we were on just once a day. We actually had to go back up to twice a day because I think this is just a bad allergy time of year for her. And I honestly think that especially, so Lana is, 4 going on 5? So at her age, honestly, I think probably we'll end up doing allergy testing and immunotherapy for her because, you know, she's got such bad symptoms, and while the Apoquil can control it with having to go back up to twice a day, and we've done the food trial and that didn't really do anything, so yeah, I think she's getting ready to get some allergy testing done here soon. So when we do that, we'll share her results. It'll be fun because this is definitely a bad time of year for her. So there is a strong seasonal component to it, and I'm sure she's got some other things, you know, from inside the house too. Since food didn't make a difference, and she's got allergy symptoms all year round. Yeah, she's got some. I'm sure she's allergic to something in my house. Probably dust mites. Let's be real. They're just everywhere. So, like Crystal said, the allergies can be very frustrating to treat and manage because they're not something that necessarily can ever be cured. And because different things work better for different patients.
You're not enough.
I'm not good enough now. Different things work better for different patients, so it's a lot of trial and error, which can be frustrating. I think it's probably one of the top reasons that people end up doing like second opinions places, because it's like, well, what they're doing isn't working, and that's why it's important to communicate that with your vet and your vet techs, so that they know what has worked, what has not worked, and so you can come up with a different plan from there. Because sometimes we just need to shift our strategy.
Well, and just remember, it is going to take time. No matter what we do with allergies.
Yeah.
If you want to find the underlying cause, it is going to take a couple weeks at least. Yeah. Minimum.
Yeah, it's hard.
You know, even if we just want to switch the food, it's still going to take 6 to 8 weeks and nothing else. Literally nothing. Like, they cannot eat anything else. So people are like, I've been doing this food for 4 weeks and nothing has changed. Well, are they getting any treats? Are they getting any milk bones? Are they getting table scraps? Is your toddler, dropping stuff on the floor? Because, it happens. We're busy. We can't watch them all the time, but it really is something that's going to take time, and it's going to be frustrating.
Yeah. So just, track the symptoms, keep track of what works, what doesn't work, what kind of improvement you see. If you can evaluate how itchy is your pet today versus next week or last week, on a scale of 1 to 10. That's important information for us to have, so we can formulate a plan that's going to work for you. Try to get them quickly taken care of, or as quickly as we can. We need all that information. It's very important. Very, very important. So, now he's balancing on my foot. So if anybody has any questions related to allergies, let us know. Do you have anything else that you would like to add or say?
I don't think so.
Okay.
Other than allergies are awful.
They're
awful. Bad for me right now. So
me too.
I can only imagine my animals.
I know. And it's like, for me, I take Allegra. That's what works best for me. Jason takes Claritin every day because he's allergic to our cat. God love him. But yeah, allergies are not fun for anybody.
Well, and with that being said too, like different cats, like your husband's more allergic to certain animals and certain cats than others. So.
He's very allergic to your cat.
He is.
He's only a little allergic to our cat. And we each only have one cat. It's not like we have, she's got multiples and I only have one. No, we each only have one cat. They're both short hairs.
Yeah, he came over and did some work in my house one day, and he sounded like he had really bad asthma. Yeah. Like after even just a half an hour.
Yeah, he came home and hit the nebulizer.
I felt so bad.
Love him. Yeah. It's crazy.
But yeah.
Okay. But yeah, if you have any questions, let us know. Give us a call or comment on our video, whatever. Apoquel is our best friend. Yes, for sure.
It's amazing.
Yes.
And for anyone who is out there and your pet is on Apoquel, you may or may not know yet, but there is a rebate.
Finally.
Yes. So if you go to Zoetis Pet Care Rewards, you just make a profile. It's super easy. You upload a copy of your invoice.
Yeah. Or you can just snap a picture with your phone.
Yeah. Exactly. And then they will mail you a little or it's MasterCard now.
I don't know. I think it's MasterCard.
Yeah, it's a MasterCard prepaid card that you can use for anything in the clinic here.
Yeah.
So you
can use it to buy refills of Apoquel.
Exactly.
And get more rewards, and then exactly.
It's awesome.
Fine. Yeah, but you can use it for vaccines and stuff too, of course.
Yeah.
But yeah, so that's good. Cytopoint I don't think has a rebate yet, but Apoquel does. It's not a lot, but every little bit helps. Every little bit helps.
I feel like it's a decent amount.
Yeah.
It's not half off, but it's pretty good.
Right? What do you think?
Do you have anything you want to say? Yeah.
He's like, I'm friends with Aunt Kelly today. Hello. Oh, hello. Thank you for putting your foot in my mouth. That was great. All right, Jaeger. You want to say goodbye? You want to wrap it up? No, you just go sit there. Okay. More kisses. Thank you. Put the link in the. Oh yeah, absolutely. We can put the link to the website in the comments. Yeah, no problem.
Does anyone have any questions for us while we're just sitting here petting my dog?
Oh, I accidentally kind of touched his ear hair. People think I abuse him.
No, you really just have to like touch his ear, and he's upset.
Yeah, it's ridiculous.
All right.
Well, that's it for today then. This was a really long video. Sorry about that, but tons of information about allergies. It's a complicated issue. So,
and if you just want to go straight to the allergy testing, you can. It's pricey, so we try other things first because regardless of what people say, we understand that cost is an issue, we try to make things as affordable as we can.
Yeah, there's a reason why our personal pets have not been allergy tested yet. Because
Absolutely.
we get it for sure. So yeah, everybody have a wonderful rest of your week. If you have any requests for videos or topics or anything, let us know. And I hope you enjoyed our super sweet dance moves. Look forward to more of those next week.
I'm gonna stop doing the videos if I have to dance.
She would not.
I would. No one wants to see that. I'm telling you.
Everyone wants to see that. All right, everybody. Have a good day. Bye. I gotta end the video, Jaker.